What are the other conditions SCA12 is confused with?
Let's start with how the patient present, and that will give the idea that how the patient can be confused for family as well as doctors. The reason I'm telling you that I have patients clearly SCA12, but they have been diagnosed as Parkinson's disease or some other condition for years altogether. In fact, the patient says that my father used to have Parkinson's disease, but it was very clear that it was SCA12. So how it can be confused? Patient generally present with tremor. Tremor means shaking of the hand or shaking of the head, or sometimes voice shaking also. When you have tremor at, say, fourth or fifth decade, the first diagnosis comes into mind is the patient anxious? Is the patient little troubled? Does the patient has a condition of essential tremor? So essential tremor is a condition that starts at that age, that present with tremor. So I would say majority of patients initially, they are confused with essential tremor. Because in essential tremor, that's another common condition. Essential tremor is seen in about 10% of normal population after, say, 60 years of age. So you can imagine that such common condition is essential tremor, and SCA12 is a minority, a small condition. And it's very common that SCA12 patient is misdiagnosed as essential tremor. So that's one diagnosis. Second is Parkinson's disease. As you know that in India or anywhere in the world, that tremor, people feel that is Parkinson's disease. So, right. So if the patient has tremor, and as you know that in SCA12, patient has walking difficulty also, which is seen in Parkinson's disease. So Parkinson's disease is a second condition which can be confused. So to answer your question, I would say that anxiety, essential tremor, and Parkinson's disease, these are three major groups where SCA12 can be confused. And I would say that as a movement disorder specialist across the India, we have seen that almost all the patients, they are diagnosed essential tremor or Parkinson's disease first, and then they are diagnosed as SCA12 after doing some test or after being a little more cognizant about it. A good thing about SCA12 is that this is not rapidly progressive. This progress is very slow, right? So people treat for essential tremor, people treat for Parkinson's disease, patient, they don't respond, then they change to neurologists who know about it, or they develop some symptoms which are not seen in Parkinson's disease. So we talked about tremor. When the patient starts gait imbalance means ataxia. Parkinson's also has imbalance, but ataxia is different. In ataxia, people walk like a drunkard. They sway on both sides. In Parkinson's disease, they walk slowly, they are stooped forward. And when we see the symptoms which are not evolving like Parkinson's disease, or in essential tremor, you'll have only tremor, no other symptom. But in SCA12, other symptoms, they start adding up. Then people feel that this is something else, and SCA12 is suspected. More importantly, we have to see family history. If family history clearly positive of similar illness, and second, if the patient belong to Agarwal family or people originating from Agroha, which is part of Haryana right now, so then you have to suspect that this is SCA12. If you want to know the difference between Parkinson and SCA12, how a neurologist or movement disorder expert they differentiate, I would say quick 2 tips here which can help doctors as well as patients also. In Parkinson's, tremor is mainly rest tremor. While they are sitting, they have tremor. They are sitting, they have tremor. In SCA12, they have action tremor. When they hold something, then tremor is more likely. In Parkinson's, they have slowness. They walk very slow. In SCA12, slowness is very late feature. It doesn't come that prominently. In SCA12, slowness is not a feature. Balance or fall is prominent. So these are the features we differentiate from Parkinson's and SCA12. Regarding essential tremor can exactly look like SCA12. But again, there are subtle differences there which we published also. Tremor of essential tremor, they're a little fast. The hand go a little fast. In SCA12, this is a little slow tremor. Action tremor, but slow tremor. In SCA12, tremor can affect a proximal area, that means shoulder and elbow more than the finger. So there's subtle difference, but yes, essential tremor is very difficult to differentiate from SCA12. In SCA12, in due course of time, they have other features like ataxia, which can become very prominent. In essential tremor, ataxia means walking imbalance. When they walk with wide base. They sway on both sides. That's generally not seen in essential tremor.